Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. Okay, what's going on, Naples? Today we have a guest. We have Dr. Chris Colosimo. He is a dentist coming from Canada. I met him recently, and we started talking about sleep apnea because I've been dealing with that my whole life, and he's very knowledgeable on the topic, so I wanted to bring him on. So, Chris, thank you for coming on.
Absolutely. Appreciate you inviting me on to talk about it. It's a very important topic.
Yes, it is. So first tell me, why did you come down to Florida? You're just out here on vacation, right?
Yeah, so down here on vacation, get away from the cold and snow of Canada and enjoy. Obviously, now that I do less dentistry, I can do a little more of my work remotely and just enjoy my time instead.
Right. All right. And how long have you been a dentist for?
So I graduated in 2014, so we're coming up on a decade and been 4 years since I touched I guess almost 4 years since I touched the handpiece. So it's time flies in that regard, but some of this information I try to keep up with, but I'm going to pull from the top of my head on from what I remember at least.
Well, the little we've talked about, you seem to know basically everything about it. So let's dive right into sleep apnea. Let's start off with saying what is sleep apnea and
Yep.
why is it a problem?
All right. So let's say general overview. Let's just think about your breathing. You breathe throughout the day and, you get a nice airflow going in, breathe out. And then you come to sleep apnea. Now you breathe in and you stop breathing. So that doesn't really sound like the best scenario for anyone to say, oh, you stop breathing. And it's not something you really think about. It happens when you're sleeping and you're kind of like, well, I slept, I woke up. What could be the problem? You stop breathing. That's the problem. So it's it's in very simple terms that would be the best way to put it. If you stop breathing, no bueno.
Yeah, there's actually something called email apnea. Have you heard that term?
I haven't, but I can kind of look at it and you fall asleep on it.
Yeah, it's like you're at work, you're stressed, and you see email come through, and you gotta hold your breath. So
Yeah.
people do that more often than they notice. Okay, so why is this besides just not breathing? I mean, I know of several reasons, but it's correlated with lots of things. Like, what are some of the things that if you leave it untreated, what can happen?
So we'll go over basically three main things that would say people would recognize and realize the most of how it impacts them is cardiovascular. And you'd say, well, what's that? That's your heart. And you think you stop breathing, what happens? You're going to try to pump harder, get back to where you were, start gasping, and try to get your system regulated again. So you're putting strain and pressure on your heart. The other part would be a lot of people may notice it during the day and not realize it's from the sleep is, well, I'm fatigued. Well, yeah, you're tired, you're not productive. So really now you're affecting your quality of life because how good's your quality of life if you're tired and you're tired making you cranky and you're more irritable. So now everything related from that fatigue, now you have a lower quality of life. No one wants that. You always want to live. We're only here for so long in life. You want to make the best out of it. So those would be the three main things, your heart, your fatigue, and your quality of life.
Yeah, and I want to add a couple points too, because we know it's correlated with Alzheimer's. We know it's correlated with diabetes. So when you are not sleeping, you're basically when you're gasping, you're in a sympathetic state, which basically triggers cortisol release, and that puts blood into sugar into your blood. So you basically over time, over decades of doing this, that's how you become diabetic, and that's the association between heart attack and stroke, because diabetes is associated with those things too. The other thing too is that you have lymphatic cells in the body, and which do drainage basically, and that we have the same thing in the brain. They're called lymphatic cells. So you need to go into the deeper stages of sleep to clear the glymph in the brain. And when you never enter those deep stages of sleep, aka apnea, that those glymph cells never drain, and you get accumulation of proteins, and that's one of the things that we know can cause Alzheimer's. So this stuff is a big deal. So let's talk about the different types of apnea because they can occur for different reasons, right?
Absolutely. So it depends. And this is very difficult to determine, but it's very, say, trial and error at best. No real studies are going to say this is exactly where the obstruction is because things change when we're awake or asleep. But basically, you can nail it down to, say, positional. Say, if you're a young, healthy person, but you still have apneic events and you're trying to figure it out, it might be positional related. So when you lay on your back and your tongue falls backwards and starts blocking your airway, then you basically cut off your source of oxygen. So that's creating your apneic event. So that would be positional just on how your body's positioned when you're sleeping. And then you can have an oral obstruction, which very similar to that tongue, but it might not be related to the position that you're currently in, and it happens in every position you're in. And then you have nasal blockages. Basically, think of people, a lot of fights and their nose gets bent this way and that. Your septum goes and blocks off the whole passageway of your nose. That's a huge way of where we bring in air to our breathing. So that's that. You can have a combination of them all, and that's a whole factor in itself. But if you want to summarize it, then those three types are going to be where you can kind of find blockages and go through maybe different solutions and ways of trying to manage the apnea itself.
Okay. So would it be correct to say that if you change positions and you still have the same amount of apnea, it's not positional, it's more either from the sinuses or the oral cavity? Is that right?
Yeah, could be that. Could be like your nerve regulation on how things are firing relative to when you're asleep and things like that. But the blockage could be, even though it might be related to position, then you can start saying it's not this, and we need to look at other factors that can help support reducing these apnea events than just changing my position at night.
Okay, great. And then you had mentioned to me some tests that you can do, like what was it, the Cottle test?
Yeah, so the Cottle test so this would be for your nasal passageway. Say for certain people, take a deep breath in with your nose and see how those two little holes called the nasal valves appear when you're breathing. So you take that deep breath in. I don't know if you can hear me when I do that, but it sounds very blocked and narrow. So when I do that, my nasal valves collapse almost completely on especially one side, and it blocks my nasal passageway. And this can also determine is it from your nasal valve or higher up in the nasal passageway. So when you do the Cottle test for this, you basically take a couple fingers, put it on your cheeks, put a little bit of pressure and pull upwards. And then you take another deep breath in. And there I still sound stuffy, but not as nasally blocked from it. And you can see it in the mirror too. If you do that, you might be like, oh, I'm getting a lot less narrowing of my nasal valve and I can breathe better. So it might be from, say, those two positions in your nasal passageway that's creating a block for you.
Okay. That's how do you spell that test? Is it C-O, is it Cottle? C-A?
Cottle.
Cottle. Great. Is there any other like easy tests that people can do at home?
Yeah, so for nasal passageways, I don't know any. For the oral passageway, if you have a nice light, say if you have enlarged tonsils, things like that, and you know how to view it, what you can do is look in the mirror. Usually you'd have, if you're in the dentist's office, they would grab your tongue with a piece of gauze or have you say ah with your tongue out and see where your tonsils are when you do that noise, if they close in and how much oral space you really have left. So if they're touching, that would be called kissing tonsils. And it could be a factor that's contributing to sleep apnea if you're blocking off your oral passageway.
Got it. Okay. That's really helpful. And this is where, I know we had talked about some people get tonsillectomy or adenoidectomy.
Yep.
That is kind of controversial, you mentioned, but that is
Yep.
one of the potential solutions there, right?
You
Okay.
can do in the airway, oral airway, anything like that is always has the possibility and potential to help. And especially if someone isn't going to be, say, compliant on some of the other solutions or gold standards that we can talk about later, then surgery is, definitely an option to consider.
Okay. And then, of course, the sort of gold standard would be like a study, a sleep study, correct?
Yeah. So the study would be the gold standard on assessing, sleep apnea. Is it sleep apnea, narcolepsy, other things that's contributed to that? Is it just snoring? Where's the fatigue coming from? if the fatigue's coming from a different source altogether. And then the gold standard solution per se or treatment would be then CPAP, so a continuous positive airway pressure that they kind of basically you would be good at describing that because you wear it every night.
Yep.
So
Yeah. So yeah, let me describe my scenario. So if I had sleep apnea my whole life, as I've gotten older and let's just say thicker, it's probably gotten worse. And I was waking up in the morning for years, finding my wife in a different room, and she was like, "This is ridiculous. We have to do something about it because I'm really bad." The snoring, that is. So she set me up with a pulmonologist. They had me fill out a questionnaire. And that questionnaire, I think, is a pretty decent tool. You don't happen to know the questionnaire I'm talking about, do you, Chris?
there's a couple different basically screening questions. One would be, I believe it's called Stop Bang, and there's another one called I think it's starts with an E. Forget the name of it, but they're basically if you type in sleep questionnaire study for obstructive sleep apnea on Google, you'll get three main. They're like super quick, one page, like 6 questions that would just go over is it potentially sleep apnea that you're having? It would be like, are you fatigued, snoring, things like that.
Yep.
Very odd, simple question to look at and be like, oh, okay, maybe this is an indicator that I should be assessed further.
Yeah, I basically got like a perfect score. Like, yeah, you have apnea.
Yeah.
So, and actually, one of the questions that always stood out to me because it changed after the CPAP. The one that I really noticed was, do you feel like you're going to fall asleep while driving? And I was like, yes, always. And ever since I've been using a CPAP, that doesn't happen to me anymore. So that was an important one. But anyway, so after I did that questionnaire, they ordered a home sleep study, which was really easy. So if you're like nervous to do this and don't want to sleep in the hospital, you don't have to do that. There are prescribers that will send you home with a home study kit. You wear it for one night. You wear a little pulse ox on your finger, a couple of like nasal cannulas, really easy. You turn it in the box, then get the data. So I turned out to be in the severe category. I was waking like 60 times per minute. So like every second I was having apneic events. So CPAP was ordered and completely changed my life. So this is a big deal. You have to take care of this. If you're waking up and your spouse is in another room, they call that sleep divorce, by the way. In fact, when I went back to the pulmonologist, he said, "Do you notice any changes?" And I said, "Yeah, I wake up and my wife's still in bed with me." So it has a positive effect in many ways. Okay, so let's go into some of the solutions. So obviously CPAP for something like severe, apnea. What about if it was more of a nasal issue? What can you do with that?
Yeah. So with nasal, depending, obviously, you always want to look at severity by having sleep tests done first and everything with that. If it's nasal, then depends if you want to go surgery. You can try a couple things before surgery, like nasal strips, which are basically like there's one company out having like yearly it's called like hostage. It's these black nasal strips and mouth tapes that they end up making. Very strong tape that basically you put it on the outside of your nose and basically pulls your nose by the way it's holding it to keep those airways open. So if you have more of a nasal valve collapse, you might put it a little bit lower. And if it's a higher obstruction, you might put a little bit higher on your nose. They have a couple of videos on and stuff like that. But out of all the tapes I ended up trying, like Breathe Right might be like a common name that a lot of people notice and stuff like that. But Hostage tape ended up being like one of the best ones I ever tried. And
Okay.
that's kind of something anyone can try, and you try a little bit of tape.
Hmm.
And then other ones would be like nasal dilators that you would put inside your nose, which can be like these little tubes and things like that. Some people can find them pretty irritating or like they slip out at night. So it's all, you always say there's something to try. And if it doesn't work for you, you move on to something else. But if you try it and it works, then, it's perfect.
Yeah.
And these are all non-surgical things and pretty cheap to try. So it doesn't hurt you. Unless you do it wrong, you cut the nasal thing and try to breathe it all the way up your nose for some reason. But other than that, pretty safe to try.
Yeah. That
And
reminds
then
me.
you can always, yes.
Yeah, I
And
tried
depending on
those.
where the obstruction,
Sorry, go ahead.
or which, no, go ahead.
Sorry, you're cutting out a little bit there. I did try those nasal inserts and it did nothing for me. Yeah, but I don't think mine is nasal at all, so that makes sense. I was just trying
Yeah, especially,
anything, just desperate to get rid of the CPAP.
yeah, especially when it's that severe, you always have to be like, you want to be careful that when you try something and say like your partner says, oh, you're snoring less, that might not be curing the apneic events. So it's always good if you're trying something, make sure you assess everything. How's my fatigue? How's, everything else? And should I do another study to assess, is this really helping reduce the apnea events, or is it just kind of mimic or masking what I think is helping and not really solving the issue?
Yeah.
So really important to make sure when you try something, even if you think it's working, make sure to do a follow-up test with it.
That's a good point. So the snoring is not necessarily a one-to-one metric. Is it possible to have apnea and not snore? And conversely, can you snore and not have apnea?
Yeah. So both of those are yes. And the one is very dangerous because you'd be called a silent apnea. And basically, in that case, you're having a ton of apnea events, but no snoring. So, and some people don't even have fatigue or anything. They don't even realize it, but it's still putting a strain and a stress on their body. And those ones are very difficult to assess and determine that, it was ever the cause because they would never get tested. So there are people like that, and it can be difficult. Other people can snore and snore loudly, and it might be loose soft tissue, such as like the uvula and things in the throat that are vibrating, causing snoring, but they might not be having any apnea events. So they can make a lot of noise, but other than that, the noise might bother their partner, and their partner might want to like put a pillow over them. But other than that, their breathing's okay.
Okay. So basically, anybody should, or everybody should fill out one of those questionnaires, at least as a screening tool. I mean, you could probably download that for free on the internet. So what about the mouth tape? Is that meant to fix nasal problems?
So the mouth tape, basically, some people like would in the earlier days take like a strip of medical tape, tape their lips together, and it's basically trying to force you to breathe through your nasal passageway rather than your mouth. It's been a long time since I looked at it, but that's basically the like overview of why they end up doing it, because your nasal passageway is meant to be like your primary breathe in, breathe out, and try to avoid mouth breathing, because mouth breathing changes breathing and you don't get as big as an airflow coming in through that way. So that's why they end up trying to do that. Now, if you're like me, we have a whole bunch of nasal problems, trying to force nasal can also cause a problem.
Yeah. Yeah, and I want to touch on that too. The mouth breathing, like if you're just a general mouth breather, that's a problem too, because it's actually really bad for your heart in that nasal breathing stimulates nitric oxide production, and that is a vasodilator. So breathing through your nose when you're at rest is really important. Okay, and then the other device was MAD, what's it called?
MAD, so mandibular advancement devices, and these would be things where you'd see your dentist and things like that, which is typically what we would call second line treatment, because CPAP is going to be the gold standard first line treatment, and then the mandibular advancement devices, MADs, would be considered mild, moderate, or for severe people, if you really have to, if they're non-compliant with CPAP.
Okay. And then with those, you kind of don't want to just grab one on the internet, right? Because that can kind of mess with your jaw, right?
Yeah. So basically, you can always say, use one of those as an assessment, say, oh, did my snoring slow down, things like that. But that's always considered as a short-term solution. And even dental offices have a better way of making a short-term one for you than anything. And then if it's working, then you can switch and have a long-term one made. If you use it short-term, it's very malleable. So yeah, it might work initially, but then your jaw starts acting as a hinge and it might not have even tooth distribution. So you have certain areas getting worn, and then it's just ends up creating more issues than you were trying to help in the first place.
I see. Yep. So who should somebody see if maybe they fill out the questionnaire, they got a perfect score like me, they're like, yeah, I have apnea. Who do they see? A dentist? They see a pulmonologist? Does it matter?
So it depends where you are. So in Canada, it's fairly regulated that if you'd always have to say, you probably have to go to your general physician first, have a referral to your sleep physician. Sleep physician is going to run the in-lab test if you do need it, and then you have a prescription, and then you pursue different routes, whether it's the MAD, CPAP, anything like that. So before that point in Canada, it can be a little more stringent on the regulations. I don't know what it's really like in the US, but Canada has it pretty set that you have to follow things a certain way.
Okay. Yeah, I know that I went directly to a pulmonologist and that worked out fine. What about in terms of like, are all dentists trained in this?
I wouldn't say all are trained. It can be something they can always look into because it's very similar to making, say, a night guard, something they'd make for, say, heavy bruxers, people are grinding teeth, things like that. But also, you want to make sure they're familiar that there's different types, and maybe your dentist, if they haven't done it before, it may not be the right one for you. And maybe you just look for someone else that has experience making sleep appliances and knows the different variations to assess, say, certain ones are better for people with short teeth and certain ones are better for long teeth for better retention and different things like that. But it's one of those things where it's hard to say we're all trained in it. We might not all know of it, or we might all know of it, but we might not all know how to go about giving you the right device for it.
Got it. Got it. Okay. And then there was one last topic I want to touch on too. It was was it called myofascial? It was the strength
Myofunctional,
myofunctional.
myofunctional therapy, yeah. So basically, these are therapists more common in the US than we'd have in Canada. But for the few conferences I was at a decade ago now, for sleep conscious, things like that, there was some myofunctional areas. And basically, this is trying to train your muscles into certain states to create a little more tone so that when you're asleep, you don't have those collapses and things like that, and try to help put you in a regulated position, such as that mandibular advancement device. It moves your jaw forward to keep your airway open. This, you want your musculature trying to help it. Now, again, kind of one of those controversial things, but if you do something that works, then I'm not going to say it's bad. So it's always worth a try doing these exercises. Maybe if you're in the mild range, it might have more of an effect than if you're in the moderate, severe area.
Mm-hmm.
But if you're in your area doing these exercises, and maybe it even brings you down a little bit to make your pressure from the CPAP a little bit less, then it always has a benefit too.
Yeah, there's nothing wrong with getting strong, right? I mean, it's not going to do any damage.
Yeah, exactly.
So, yeah, okay, great. This is all fantastic info. Is there anything we missed here?
The sleep aids, positional. I guess for the some of the positional stuff, there's things you can look at like positional wedges, which or positional pillows, which keep you on your side so they don't let you roll on your back. Those are always something to try. There's positional wedges that basically have this little like 45-degree angle that you sleep on. So it's basically trying to keep your upper body elevated a little bit to reduce that ability of your tongue falling back and blocking your airway, things like
Mm-hmm.
that. So a lot of things out there to look and try and things like that. If you think, maybe I'm having a problem and it's taking a while to say if it was in Canada, sometimes it can take 2 months to see your general physician before you can even get a referral to see a sleep physician. You might want to try a few things before you even get to that point and see if anything helps so that when you do see them, say, I've tried this. Maybe I noticed an improvement. Maybe I haven't. Gives you a little more, say, information and data to feed back to the specialist to then help determine what's better for you.
Okay. So I think overall, like to sum this all up, if you suspect you've got some apnea, or anybody should just fill out one of those questionnaires first, probably. Tell me if I'm wrong on any of this. And then maybe do that Cottle test on yourself, play with different positions and see if that changes anything. And I think, and maybe try some nose strips, mouth tape. And if you're still having a lot of problems there, you can also do the strengthening, the myofunctional strengthening as well. If that changes nothing, go get it properly assessed. Don't let this one sit by the wayside because it's a big deal. Is that
Yeah.
a decent summary?
Yeah, absolutely. It's definitely one of those things where falling asleep while driving, you don't notice at the time, but it kills you and others.
Yeah.
So it's
Yep.
it's definitely important, especially with how much we all drive now.
Okay, perfect. Well, Chris, I want to be respectful of your time. Thank you so much for this information. This is going to be really helpful for my community. I really just strongly want to thank you. So it's been great meeting you, hanging out with you, and I wish you the best.
Yeah, absolutely. I appreciate the talk, and hopefully some of this can help someone else.
All right. Thank you. Why guess when you can test? Do you get hangry or crash after a carb-heavy meal? These could be indicators that there is a dysfunction in your blood glucose regulation. If left unchecked, it can lead to irreversible changes. If you catch it quick enough, you can make diet and lifestyle changes that will get your levels where they need to be. 88% of Americans are pre-diabetic and don't know it. Diabetes underpins many of the pathologies we deal with in this country, such as obesity, high blood pressure, heart disease, and stroke. For some reason, it is rarely screened with your physician, and if they do test for blood glucose, it's usually with an A1C or a fasting glucose, which can sometimes give you a false negative. Nutrisense is a company that supplies continuous glucose monitors. We've paired with Nutrisense to get you real-time data to see how your physiology responds to glucose. The Nutrisense app lets you track your daily activity to see how food, sleep, exercise, and stress impact your glucose. You can log or import this data into the Nutrisense app to see the effect on your blood glucose levels as soon as it happens. Use the code DrChris25 for $25 off your order today. Do you have unexplained pain, or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great tool to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's thyroid function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It is sent to you with free shipping, and you get results in 2 to 5 days. No physician referral needed. Use the code DPT25 for 25% off. You can find links in the show notes. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.